Hey, what's up guys? It's Victor from Cyborg for Life. Hope you guys have been really well, staying safe. I know the pandemic is not over yet, but Pfizer just released a statement saying that they may have a potential vaccine that is up to 90% effective. So let's keep our fingers crossed and hope that works. Anyway, today I want to compare the internal and external fixation devices for limb lengthening surgery so you can gain a bit more insight into the pros and cons of each. And so we're going to go over things like the differences of device structure, price, complications, deformity correction capabilities, and lengthening capacity. And then towards the end, I'm actually going to give my own personal take on the two methods since I've actually had an external fixator and an internal lengthening nail throughout different times of my crazy cyborg life. So let's start off with the device structure. When you think of limb lengthening devices, it's pretty hard not to relish in the evolution of something that can actually make your limbs longer by slowly pulling them apart at a particular rate each day. These devices have a long history, starting off with the monolateral fixators, going to the external ring fixators, going to the internal external fixators, going to the internal lengthening nails, and then just recently with the internal lengthening plates, like the precise plates for kids, okay? Now, external fixators are easy to identify because they're, well, external or fixated on the outside of your limbs via metal pins that transfix through the muscle and bone from the outside in. The internal nails, on the other hand, are implanted on the inside of your long bones, held in place with screws. Now, the more advanced internal lengthening nails are usually lengthened within a remote control device, which is placed on the outside of your limb and lengthens the nail via magnets. Size-wise, the external fixators are large and in charge. They take up a ton of real estate on your limbs. And regardless if you have the monolateral or the circular ring fixator, it can be hard to wear clothes normally, okay? I'll actually talk about that later, but it can limit your range of motion. It can make things like moving around or your physical therapy a bit more challenging. Also, if you're in bed, there's only like a few positions that you can be in without the fixator being a nuisance. And well, after a while, you just get, I don't know, tired of wearing it. Now, the internal lengthening nails and plates are much more, stealth-like since they're on the inside of the medullary canal of your bones, and no one's going to actually know you have a lengthening device inside you. The nails actually allow you to wear clothes, maximize your range of motion, and they're much more comfortable to wear throughout the day than their external predecessor. So what about the price? It's a well-known fact that the external fixators have been around a lot longer. They're also a lot cheaper, okay? Like a lot cheaper. In fact, this is the main reason that the internal nail procedure can be pricey for something like stature lengthening when you add to it like surgical fees, hospital stay, physical therapy sessions. So yeah, internals are way more costly than your external counterpart. Device complications. Since externals are transfixed through the soft tissues with metal pins, okay, at least during the duration of the lengthening phase, you have a greater chance of developing an infection, okay, if you don't keep the pin site sterile. On top of that, it can actually cause muscle tethering, which I'll give you an example on this later, but it basically means that it pierces your muscle fibers and can get twined up in the soft tissues, making a huge mess, and at least on the femurs, because you have those huge quad muscles, which is one of the reasons why surgeons aren't really using external fixators on the thigh anymore, okay? For lengthening, that is. And remember how I said external fixation can actually cause a lack of range of motion due to its bulk? Well, this can actually increase your chances of developing a muscle contracture if you can't do your flexibility exercises to the fullest. What about internals? What type of complications could this cause? Well, the nails are inserted into your bones through, like if you're getting it in the femur, through the hip for the femurs, and then through the knee for the tibial nailing, okay? This could cause some sort of pain for some time after surgery, and I'll touch on this a little bit later when I talk about my own personal methods. So right there you have four major complications that could occur with these devices. Although internals have pretty much won the battle of efficiency up to this point, let's give some love to our externals with the ability to do deformity correction. That's right. Although the internal nail can, can be used to correct things like knocked knees with blocking screws or rotational malalignment issues, it's mainly a lengthening nail, whereas the ring fixator, like the Taylor spatial frame, it was made for deformity correction. It can work magic for complex deformities that an internal nail can't do. You think about the lengthening capacity, the internal nail, like the precise stride, has a max length of 8 centimeters. And if you figure that's what the experts have determined to be the max safe length, at least for femur lengthening, and the external fixators usually can go a little bit further, but along with it, complications could occur. Okay, with some rare exceptions for if individuals have some sort of form of dwarfism like achondroplasia, because their soft tissues have a little bit more reserve slack. But anyway, I want to talk about my personal experience. So as you can see, each device has its special capability and what it can do. And me having both devices, I actually had a standard monolateral external fixator to hold my femur in place after I broke it to let it heal when I was hit by a car. And yeah, and if you're wondering how I got hit by a car, I was a 9-year-old kid crossing the street to go to the library to look up my holographic Pokemon cards. Okay, when a car sped a red light change, like when it's changing from yellow to red, and boom, I was damaged goods. And then I was ambulanced off to Sinai Hospital where I had an external fixator attached. Well, the thing that I noticed with the external fixator pins, they went through the pin sites, they went through my outer quad muscle, and they actually had this muscle tethering effect. And years later, when I got into bodybuilding and built up leg muscle, I developed these 4 pinhole-like hernias where like the soft tissue kind of like, you know, kind of fluffed out. And you know, that was not a you know, aesthetic at all for bodybuilding. Now, it's not as big of a deal for the tibias because the calf muscles aren't as big, but for the femurs, you have the big quad muscles, or at least you should. If you can feel your femur bone on your thigh, then you might want to eat up a little bit and hit the gym. But yeah, so that basically kind of caused like a really weird look to my leg. And the pin sites had to be cleaned a few times a day, which is really tedious. And physical therapy was pretty darn painful, I remember. And then I had to wear these slits on the sides of my shorts and pants to be able to dress up properly. So yeah, it was a really meticulous process. I mean, thank goodness for Dr. Conway. I mean, she's awesome. She basically, you know, fixed the fascia and thus the shape of and the contour of my quad, so that, you know, this was all during the lengthening of my tibia, but she went and did my quad as well, just, you know, for the heck of it. God bless that woman. I mean, she's amazing. But anyway, now I got my tibia lengthened in with the original Precise Nail in 2012. She did have to go through my patellar tendon to put it into my tibia. And my knee was rather sore and tender for about 1.5 to 2 years. Not to mention the removal a year after the original surgery, which definitely pissed me off. I mean, here you are, you recover, you heal up, and then all of a sudden you got to get that thing removed. It sucked. But anyway, with some PT, stem therapy, which was huge, it was huge to my success, and my rehab program, I was able to strengthen that knee to eventually do crazy things again, like lift heavy, sprint, jump. And although I am mentally more cautious, so I don't jeopardize my natural bodybuilding championship run, which is going to happen in the next few years. So that, as you can see, both have their downsides, but I hope you're able to see the differences between the external and internal devices and get a little insight into which one you might get. But if you were to ask me, I would say that the internal lengthening nails are a game changer. And if you can, opt for that. I mean, budget or availability permitting, but if you are able to, definitely do it. I mean, yes, it has to go through your hip for the femur lengthening or your knee for the tibial lengthening, and it can cause some temporary soreness for a while, but in nearly every other category, it wins out, okay? I mean, unless you have some sort of major deformity and need major correction with an external fixator. All right? Guys, that's all I have for you today. I hope you enjoyed the video, and if you did, you know what to do with that thumbs up button. Be sure to subscribe for more videos coming your way, and until next time, this is Victor from Cyborg for Life, signing out. Peace. Oh, and speaking of these, you know, really rare Pokemon cards, they're actually making a comeback from what I hear, and they could actually be worth something now. So if you still have rare ones that are in good condition, definitely check it out. I mean, talk about saving up for your lengthening procedure. Trading card arbitrage, it works. I haven't done it, but I might want to.